Leading a startup team, whether you're delivering a sugar rush, stocking coffee, or getting a regular delivery of snacks, Office Depot has solutions that fit every startup culture, from getting those first business cards and stationery to ordering fleece pullovers with your new logo. To learn how Office Depot and the California Technology Council have partnered to bring you savings on all of these startup essentials and more, go to californiatechnology.org/member benefits. I'm Daniel Levine, and this is the Bio Report. For anyone who has ever sought to find the price of healthcare services before obtaining them, it will come as little surprise that information is not readily available. A recent study from Public Agenda, with support from the Robert Wood Johnson Foundation and the New York State Health Foundation, set out to find out how Americans seek and use healthcare price information. We spoke to David Schleifer, Director of Research for Public Agenda, about to what extent healthcare consumers seek price information, the implications of having a system with little price transparency, and what can be done to fix the problem. David, thanks for joining us.
Thanks for having me. I'm glad to be here.
We're going to talk about recent research from Public Agenda, the state of price transparency in healthcare today, and what can be done to change that. One of the arguments that's often made is that consumers of healthcare aren't generally the ones that pay for it, and there's this disconnect, and this disconnect is one reason that many people don't do price comparisons before obtaining healthcare. But before we get into the findings in your report, what is the landscape, and to what extent do people in the United States pay for their own healthcare?
Good question. I mean, people are really on the hook for a lot of their healthcare costs. I would sort of dispute the notion that people don't pay for their healthcare directly. I mean, certainly, uninsured people are on the hook for everything, and there's still millions of uninsured Americans. But even people who have insurance through their employers face significant out-of-pocket costs in the form of premiums that often are coming straight out of their paychecks, and then, of course, deductibles, co-insurance, and co-pays. There are people who have deductibles in the multiple thousands of dollars, and we know that wages are stagnating for a lot of people. So $2,000, $3,000, $4,000, $5,000, or even $6,000 deductible, which some people have, that takes a pretty significant bite out of people's income. So people really are on the hook for a lot of the cost of their care. And I think some policy folks in Washington would probably add that, of course, people really pay for all of healthcare because as taxpayers, we're paying for things like Medicare, Medicaid, veterans insurance, and the like. So we're all paying for it somehow.
Well, there is a stunning lack of transparency in healthcare, but one of the things I found most surprising in your findings is that many people are unaware that price differences even exist. How is that possible, and what did you find?
Yeah, it's definitely hard for those of us who, pay attention to healthcare. We know that there can be really significant price variation. You could, pay very different prices for the same service, the same MRI down the block from each other, in the same city. What we found was that less than half of Americans think that doctors, less than half of Americans are aware that some doctors charge more than others for the same services. We also asked about hospitals, and less than half are aware that some hospitals charge more than others for the same services. We asked about, doctors or hospitals in people's networks or in their geographic areas. And the rest, they either think doctors or hospitals charge pretty much the same price for the same service, or they don't know. And actually, a lot of people say they don't know. So 19% of people say they don't know whether some doctors charge more than others. I think that's, in a way, the fact that so many people are willing to admit that they don't know is kind of encouraging, because it shows that there's room for for some progress on that issue. There's room to improve the percent of people who are aware that prices really can and do vary.
To what extent do people actually seek price information before obtaining healthcare services, and do they comparison shop, or do they simply seek the information from a single provider and deciding whether or not to have a specific procedure done or get certain types of care?
Right. Yeah. So we found that half of Americans, 50%, said they had tried to find healthcare price information before getting care. We found that actually somewhat higher percentages said they had done so in Texas, New Hampshire, and Florida, which were three of the other states where we focused this research. The number of people who had tried to find price information in New York was 48%. It was statistically about the same as the 50% who tried to do so nationally. But I think a really important thing to understand about this research is that looking for price information does not mean comparing prices. People often use this term shopping around, like people are going shopping for a sweater or something. And that's just not what a lot of people are doing. So we found that, if you think of that 50% of Americans who tried to find price information, within that there's 20% who tried to compare multiple providers' prices, 28% who tried to check one provider's price, a few who we couldn't tell which they'd done, and then the rest who'd never saw price information at all. So about 1 in 5 Americans has actually tried to compare multiple providers' prices.
And is there any correlation you found between people seeking price information and they're actually saving money?
Absolutely. Yeah. We asked people who had tried to find price information, did they save money? And more than half said that they had. I think it was 53% of Americans said that they had. And actually, in some states, it was higher. In Texas, 69% of people who tried to compare prices report that they saved money. I think part of what's interesting about this finding is that if you, a lot of the other research on this topic, while very good, has looked only at how people use online price information tools and has found limited usage of those tools and limited price savings for people who do use those tools. But because we asked about a whole broad range of sources that people might use to try to get price information, I think we have a more complete picture of where people are going for this information, and therefore we're better able to pick up how many people are saving money, choosing less expensive providers, and ultimately, we hope, kind of protecting themselves from some of the high healthcare prices that are out there.
So we think of information today being ubiquitous. Where do people go to get price information? How easily is it obtained? And are there reliable sources of information they can turn to?
It's a good question. I think that, again, when people hear price transparency, people just think about websites. That's what people picture. I think especially for those of us who work at a desk and sit at a computer all day, of course we do everything online. But when we ask people how they are actually trying to find price information, there's really a much broader range of sources that people are turning to. There's some slight differences between the states, but for the most part, the most frequently used source is friends and family, and that's similar for all sorts of things. It's not really surprising. Then people are asking their insurance company either by using their insurer's website or by calling their insurers on the phone. And we didn't actually break those out separately. We just asked, have you contacted your insurance company or used your insurer's website? That's kind of one item. I sort of in retrospect wish we had asked those two things separately. But then, people are asking their doctors, they're asking their receptionist or other staff in their doctor's office. Those are sort of the top sources. And then there's some others, hospital billing department, nurse, sort of pretty far down the list of commonly used sources are websites other than people's insurer's website. And of course, there are a lot of these websites out there. Only about 20% of people who tried to find price information said they had used them. And then mobile apps were the least commonly used source. We have a sense from our focus groups that people like talking to a human being about price information, in part because it's part of a bigger interaction about, like, where am I in my deductible, for example. And when we did the focus groups for this report, we found that a lot of people said, they wanted to talk to a human being. They wanted to talk to someone who could help them understand the information they were getting, answer other questions along the way, and tell them where they were in the deductible so they'd know how much it was going to cost them.
Payers would like to see consumers grow more price sensitive. Certainly, one way they've done that is by shifting costs more to consumers. But have they done anything to make this information more readily available? And if so, has it had any impact?
Yeah, certainly we know that a lot of insurers have price information tools, and this wasn't really part of what we focused on in our research, but I've seen estimates from other researchers that virtually every insurer has a price information tool. Whether those tools are any good or how good they are, I think, is another question. I know that Consumer Reports has done some work on trying to sort of set some standards for what a good price information tool from an insurer ought to look like. So these tools are definitely out there, but I think that there are sort of questions about there's variation in quality of these tools. And I also think that one question that I don't know, I don't know if these tools necessarily, which insurance tools answer this, but do they give comparative price information? Do they say, well, if you get the procedure here, then it's going to cost this much, but if you go down the street, you might be able to save some money. I don't know how many tools actually do that.
Do people think if they shop around and save money that it comes at the cost of quality?
No. That was one of the findings that we were really excited about when we did this research before. We found that most Americans do not think higher price care is higher quality. And when we did this research again, we confirmed most people do not think that higher price care is higher quality. Most people don't think lower price care is lower quality. The responses to that are a little different, but overall, people really don't think that cost and quality are associated. So, and I think that that's different from what a lot of healthcare experts had believed for a long time. And I think it's encouraging because I think it means that people aren't worried that they're going to get worse quality care if they go, to the less expensive provider.
State governments play a great role in regulating healthcare. Is there a wide variance in approach that states have taken with regards to price transparency, and has that had any effect?
States do vary quite a bit. Um, it's there's another organization called Catalyst for Payment Reform that has done quite a bit of research on what states are doing in terms of price transparency. Catalyst gives very few states, I think only three or four, a grade of A for their price transparency regulation. Most states get an F. I think 43 states get an F, but a lot of states are in this process of trying to figure out what they can do, what they should do. One of the things that I think about half of states have done is create something called an all payer claims database, which it sounds boring, but it's a really crucial sort of piece of the price transparency data infrastructure because it's a data repository that brings together data from all sorts of payers across the state, and that can be used as a data source for price information websites or for all kinds of other initiatives the state might want to undertake. There are states like New Hampshire. New Hampshire is sort of regarded as having the most advanced price information website as a state, and because you can put in your own insurance information, your own deductible, your own co-insurance, and it'll tell you the price that you will pay. That's pretty advanced compared to what most states have.
Who's in the best position to improve price transparency?
I think that there are roles for a lot of different players in this. I think states certainly have a role to play. I mean, we certainly saw in the survey that a strong majority of the people think that their states should provide comparative price information. So I think states definitely have their roles to play. Insurers certainly have an interest in helping people save money, although we did find that most people think insurers are mostly interested in making money. So I think there's a bit of a trust gap there between insurers and the public, that I think there's some work to be done in kind of bridging that gap. And then certainly physicians, doctors, and their staff. This isn't just about doctors, but most people really favor doctors and their staff talking to patients about price. I think that those can be awkward conversations, probably for both sides, but most people say we found that in our survey that most people say it's a good idea for doctors to talk about price with patients. So I think that there's certainly roles for all of those stakeholders to play.
What types of action do you think would be most helpful, and should certain segments of the population be more targeted than others for this type of information?
Well, not surprisingly, the most the some of the folks that were most likely to be seeking price information are people with higher deductibles. There's actually kind of a perfect line between the size of people's deductibles and their likelihood of seeking price information. So certainly people with those higher deductibles are the most obvious kind of audience for price information. But they're not the only one. I mean, one of the things we found was that at least in some states, people who have recent experience having been uninsured were more likely to be looking for price information. So something about that, that recent experience of having been without insurance coverage, those are folks who we found are more likely to be looking for price information. So I think that there's, reason to focus on the newly insured or people who have this kind of churn in their insurance. And then one of our other findings that I think was interesting was that people who say they're a caregiver, that they're making a healthcare decision for another adult family member, those folks are more likely to be people who are comparing prices are more likely to be making healthcare decisions for another adult family member. There's something we think about, being in that caregiver role that seems to be associated with with not just seeking price information, but with comparing prices.
And in terms of any specific recommendations you'd have to improve transparency?
Well, as I said, I think there are roles certainly for doctors and for doctor staff in getting more comfortable talking about price with patients, because that's one of the most commonly doctors and their staff are one of the most commonly used sources of that information, and they're right there in the exam room. I mean, I think that there's some tough questions to be answered about how to fit that into the clinical workflow, and I know that there are other organizations that are working on those questions right now. So I certainly think there's a role for doctors, and I think that states certainly can do more. I think that a lot of states don't even have an all-payer claims database, so I think there's certainly reason for states to consider doing that, because that is the the sort of the underlying data that's needed for price transparency. I really also would like to just make sure that people understand the full range of ways that price information gets transmitted to patients, and really just make sure that it's not all about building the coolest website, because no matter how good the website is, if that's not where people want to go for the information, or if they don't know it's there, then that's not meeting people's needs. So, there are roles for the customer service reps at the insurance company, I think are kind of an untapped resource here. It's not very sexy, but if that's one of the places where people are going to try to get the information they need, then we certainly need to make sure that those folks on the other end of the line are able to help people, get the information that they want about how much their medical care is going to cost them.
David Schleifer, Director of Research for the nonpartisan and nonprofit Public Agenda. The report is still searching and can be found on the Public Agenda website. David, thanks so much for your time today.
Thank you. Thanks for having me.
Thanks for listening. The Bio Report is a production of the Levine Media Group. To automatically download this podcast each week, subscribe to our RSS feed or through iTunes or other podcast manager. To join our mailing list, go to levinemediagroup.com. We'd love to hear from you. If you want to drop us a line or are interested in sponsoring this podcast, send an email to danny@levinemediagroup.com. Special thanks to Jonah Levine, who composed our theme music, and the Jonah Levine Collective, which performs it.